Canada is known around the world as a country that provides free health care to its citizens, but is it actually free? Of course, someone, in fact, is paying to build hospitals, buy equipment, medicine, and to pay medical professionals. That person is Mr. and Mrs. Taxpayer. My guest now is Bacchus, Barua, the Associate Director of Health Policy Studies at the Fraser Institute in Vancouver, BC. Welcome back to BCN, Bacchus.
Thank you so much for having me on the show again. It's lovely to see you again.
You too. Healthcare is the costliest part of many governments' budgets, but do Canadians understand how much each of us is putting towards healthcare costs?
You know, it's a remarkably difficult thing to do. We don't really have a dedicated health insurance tax. We don't really experience fees when we go to hospitals, and it's contributed to this myth that we have a free healthcare system, or at least that's how other people in other countries refer to it. I think most Canadians know that we do pay something for our healthcare system. The question, of course, is how much.
Yeah, how much is the average family paying in taxes for the healthcare system? And by healthcare, what would that actually include? Would it be dentists and pharmaceutical costs?
So what we did in this study is we looked at the cost of the public healthcare system. So this is everything that Canadians contribute for basic core medical healthcare services. So it doesn't really include costs for things like dentists or pharmaceuticals that are got outside the system. But when we take all of it together, we find that the average family is actually contributing about $13,300. So sorry, $13,000 300 for the average family of four. The average unattached individual, single person, is paying about $4,500 for the public healthcare system. We can talk about whether this is a really high number or a really low number, but it's certainly in stark contrast to the notion of free healthcare.
Yeah, how does it really compare to other countries around the world, including the United States and countries in Europe?
Well, it's very difficult to do an apples to apples comparison when we're looking at the cost for our public healthcare system for each one of these families. The best that we can do is actually look at the total cost of our healthcare system. And we routinely do that by looking at Canada compared to other countries with universal healthcare. And yes, there are at least 27 other countries with universal healthcare. And when we look at Canada in that cohort, we actually usually stack up amongst the top spenders. We're spending upwards of 11% of our GDP and ranking between 4 and 11 out of 28. Depending on which measure we look at. Again, very different from the notion of free healthcare system, and actually one of the most expensive healthcare systems amongst universal healthcare countries.
You know, what's interesting too is that my wife had to have some surgery, some heart surgery recently, and we looked at in Canada here, it was all covered, of course. We're very blessed and very thankful for that. But that same surgery in the United States would have been $120,000 without insurance. So it really is an eye-opener for a lot of Canadians, you know, when we realized how blessed we really are.
Well, I'm sure if that same surgery in the United States was covered by private insurance or Medicare or something like that, again, people wouldn't be paying out of pocket. So it's really a question of insurance coverage. But that's why I think the conversation of, about us centering it between Canada and the United States really leads to a lot of misleading conclusions. Canada really should be compared with other countries with universal healthcare. So countries like Switzerland, the Netherlands, Germany, Australia, France. They all have universal healthcare. They're spending about the same as we are in that cohort, but they actually routinely have more doctors, they have more beds, they have far shorter wait times than we do, and they have roughly the same, if not better, outcomes. So once we start to get that comparison into question and we realize that, okay, we can have universal coverage, it doesn't really require a public monopoly over it. We can also do it through private providers. And then we tweak the question to, how do we actually just get the best healthcare system that delivers timely access to care, regardless of ability to pay, but without really necessitating it to be either government or private. It's really about what delivers the best care to Canadians. But again, even before we get into those conversations, a fundamental part of that equation is how much are we actually putting into that system? And I think a lot of Canadians would be quite surprised to know that they're actually contributing $13,000 towards their healthcare system this year. And then when you take that cost, it becomes a question of, okay, well, are you actually getting good value for your money?
So how did you actually come up with the number of $13,000? Because I mean, in Canada, we don't actually have the direct dedicated health taxes.
Yeah, it's actually remarkably difficult to do that. And that's one of the reasons why Canadians also have a tough time with it. We do have two good statistics that we can look at. We can look at the overall cost of our public healthcare system. So that's about $160 billion. And we do have a general idea about how much the tax burden is for different families. So, for example, for a single individual and for a family of four. And once we combine those two numbers, we get a general rough estimate of how much these families are contributing through the tax system. And it's important to put a caveat over here and remind viewers that we're paying for the healthcare system not just through our income taxes or through healthcare premium. We're paying for it through a multitude of different taxes that we see as sales taxes or employment taxes and a variety of different things. It all goes into general government revenues, which makes it very difficult to try and figure out. But our best estimates are that the average family of four is spending about $13,000 for healthcare, and of course, it does vary by income. At the bottom 10% of income earners are probably contributing about $500 a year, whereas the top 10% of income earners are actually contributing upwards almost $40,000 a year.
So, Bacchus, can you give some perspective on how much healthcare costs have really increased in Canada?
Yeah, we're very fortunate to be able to calculate these figures all the way back to about 1997. And what we see is that when we take all the families combined, healthcare spending has actually grown about 3 times as fast as the cost of, for example, food. It's grown about twice as fast as expenses for clothing and shelter, and importantly, it's grown faster than incomes. So if we just take total healthcare spending, it's grown by about 184% for the average family, whereas their incomes have only grown by about 106%. So there's that clear imbalance over here. Was telling you a little bit about the sustainability of these increases over time.
So how does the current tax for healthcare compare to what it was like, let's say, 20 years ago?
Well, the interesting thing is that if we look at just the last couple of years, we've seen a bit of a slowdown in the increases of healthcare spending for the average family. But this has come on top of dramatic increases in spending throughout most of the 2000s. So again, when we contrast it for healthcare for the average family, it grew by 180% since 1997, but incomes only grew by about 100% since 1997. So even though it's slowed down a little bit over the last couple of years, that's on top of skyrocketing increases throughout most of the 2000s.
So what kind of an impact is this really having on Canadian families? Are people saying, you know what, we're going to have to do with less food to pay for a lot of our health care?
Well, I think this is something that a lot of governments are starting to struggle with. You can't have infinitely increasing expenditures on healthcare without something else having to give way. Either governments are going to have to increase taxation, or you're going to reach limits on how much you can spend on other social programs. What we're seeing right now is that governments have basically started to slow down their increases of healthcare spending. So it's still increasing, but at a slower rate. And of course, we see the result of that, which is rationing of services. At the same time as these increases have taken place, so have there been increases in the average wait for treatment. For example, the average wait for treatment was about 19.8 weeks the last time we did the survey last year. And I don't remember the number in 1997, but in 1993, when we started that survey, the wait was only 9.3 weeks. So, large increases in wait time over the last 2 or 3 decades. At the same time, we're actually seeing increases in spending. So there's a mismatch somewhere between what we're putting into the system and what we're getting in return.
So the bottom line back is, why are healthcare costs rising at a much faster rate than practically everything else in our country?
I think that's a really good question for Canadians to ask themselves, for policymakers to actually to ask as well. The question really is that the increases in spending is one part of the equation, and they could be fine. It's fine to have increases if you're getting commensurate value and return. If you're starting to see decreases in wait times, if you're starting to see huge increases in the number of physicians or MRI scanners, but we're not seeing that. We're seeing an imbalance where on the one hand, we're increasing our spending, but on the other hand, we're also seeing longer wait times for care. And the simple answer to that is we really haven't seen any shifts in policy. This is an old approach of throwing money at a problem and hoping it goes away. And that just doesn't really seem to work.
What's really interesting is the fact that a lot less Canadians are smoking today, which you would think would have a lot less of a burden on our healthcare system. So maybe costs should be coming down instead of going up.
That's something that we haven't really looked at in terms of actual population health and what that does to healthcare costs. That's what one should expect and would hope would happen. But this is really a question of, we have a system where the incentives are such that there is no tempering of demand. We have no cost sharing, and so you have essentially infinite demand for services. You have limitations in the supply of services because there is only a single payer. essentially government, or there are many payers in terms of us being taxpayers. But that leads to an imbalance between supply and demand, and that's why we see the rationing that we do in terms of things like long wait times.
You know, it seems that in Canada, as soon as we use the term private, is used in healthcare discussions, governments panic and they worry about losing votes. Any thoughts on how that could possibly change?
I think we're increasingly aware of how universal healthcare is done in other countries. I think Canadians have a better understanding of the fact that universal healthcare doesn't necessarily mean government healthcare. We can see successful countries like Switzerland, the Netherlands, Germany, all having universal healthcare systems where they embrace the private sector, where they have co-payments and cost sharing, and the results are clear. While they're spending about the same as we do, they have more physicians, more beds, shorter wait times. I think we're going to be a lot more open to having these conversations in the future.
What do you say to those people that say, though, you're creating a two-tiered healthcare system?
Well, we already have a multi-tiered healthcare system. And in particular, we have a system where if you're rich enough, you can escape our healthcare system's problems by going to a different country. That's really not how you want to design healthcare. Essentially, I would hope that people design a healthcare system where rather than the preservation of the system, we put patients first and say, look, it doesn't matter whether it's public or private or if they're co-payments. We want to ensure that patients are getting adequate treatment in a timely manner. And of course, when we talk about things like co-payments, all these countries have exemptions for vulnerable populations. It's an understanding that these are important signals to send, while still understanding that we want to make sure that nobody has a huge cost burden for healthcare. There are other ways to do it. Other countries have figured it out, and we should look at what they're doing.
So, Bacchus, what can we learn from provinces that have already experimented to some degree with private healthcare? Has it been successful?
There's one province that actually has thought outside the box and had a fair amount of success with private healthcare, and that's Saskatchewan. In the late 2000s, Saskatchewan had some of the longest wait times for healthcare in Canada. They started something called the Saskatchewan Surgical Initiative, which, amongst other things, actually contracted services out to private clinics. They also started a pool referral system, and the outcome was very clear. By about 2014 or 15, they actually had the shortest wait times in the country. Now, of course, there are limits on what Saskatchewan could do within the confines of the Canada Health Act, but it provides us a very simple example of how we could improve healthcare in our country within the confines of the Canada Health Act.
Have there been any real issues, any difficulties when it comes to private healthcare so far in our country?
There's nothing really that we've seen. Most of these other countries introduce private healthcare in a regulated market. They understand that it's a partner that needs to ensure that it's delivering services to patients regardless of ability to pay. And as far as we've seen, there really aren't significant issues with delivering treatment across the income spectrum in countries like Switzerland, Germany, and the Netherlands.
Are Canadians getting good value for the amount of taxes spent on healthcare? What are your thoughts?
Well, let me answer that in two ways. In the pure statistical way, we see very clearly that we are one of the highest spenders, but we have very few medical resources and we have some of the longest wait times. So in that sense, we're not getting good value for money. But ultimately, the only people who can answer that question are Canadians. But before they answer that question, they need that one important piece of information, which is how much are they actually spending on healthcare? And that's what we're trying to figure out today and help them understand that as an average family, you're probably spending about $13,000 for healthcare. It's up to you to figure out whether you're getting good value for your money.
Is there anything changing on the Canadian landscape in relation to healthcare? Is there an appetite for allowing maybe more private healthcare into the mix?
Well, I think the newer generation is far more open to the concept of private healthcare, especially as not really seeing it antithetical to universal healthcare. We're seeing court cases fought in BC with Dr. Brian Day's clinic, who's fighting for patients' right to get treated in a timely fashion when the public system fails. We also have a generation where we're used to having timely services delivered across the spectrum, and I'm sure that same attitude is going to come to healthcare. And of course, it's important to remember that does not have to stand against the concept of universality. There are other countries who figured it out, who are using the private sector to deliver the universal healthcare promise.
Bacchus Barua, the Associate Director of Health Policy Studies at the Fraser Institute. Thanks a lot for joining me today from Vancouver, British Columbia.
Thank you so much for having me on the show.